Hello. Tonight I want to talk to you about a more permanent treatment of ingrown toenails. So yesterday we talked about the temporary treatment, some of the common ways that you can actually treat an ingrown toenail that doesn't solve it necessarily long term and doesn't really modify the nail itself. So now I'd like to talk to you about two options that there are to remove an ingrown toenail in such a way that it is more permanent. Now, in saying that, I've talked to many individuals where they actually go in there being told that the nail needs to be removed completely, or that even recommended that you take the nail off completely and kill the nail so that it never comes back. Now, although this is doable, although I've done it before, this is very rare and I don't recommend it. So instead, you're going to do a less aggressive type procedure, but still a procedure that can be long-term, can be a long-term treatment for the ingrowing nail. So as you remember, an ingrowing toenail is where the edge of the nail is growing in and curving in and actually catching or growing into the skin and causing significant inflammation, significant pain. And the idea is you need that portion of the nail removed to solve the problem. So the best way to treat an ingrown toenail is to numb the toe up, to use anesthetic where you actually numb the toe up on either side and the whole toe itself is numb. And then what you do is you take a little sliver of nail, not the whole nail, just a little sliver of nail on the outside that just takes that portion of nail out that is ingrowing in the skin. And so once the toe is numb, you can actually take that and you can go all the way back, even underneath the proximal portion of the nail, or the nail portion that goes underneath the skin, and you take that whole piece out. And once you remove that whole piece, then you need to do something more permanent to make sure it doesn't come back. And this is where the two different options come about. One of them is a method to actually create a chemical burn to the nail matrix. So you want to kill the nail bed where the nail grows from, the nail matrix, so that it doesn't regrow. And a process that we found to be 99% effective is using phenol. Phenol is a chemical. It's actually an alcohol that creates a chemical type burn similar to an acid that do to the nail matrix, so it kills that nail portion. So you take a small cotton swab, dip it in phenol, and you place it on that nail bed and you burn the nail bed so that that portion of the nail should never come back. The good news is all you've done is you've taken that little sliver of nail out, and then the skin grows up to the side of the rest of the nail, so it actually looks normal. So you don't have that a big hole or anything like that in that area after it heals. So that's one option that's quite effective. It's commonly where we'll start because it works so well in 99% of the individuals. 1% of the time it does come back, and if it does come back, you can retreat it and do some other treatments if necessary. The second is instead of creating a chemical burn, you actually take a surgical scalpel and actually cut out the nail bed. Typically, we don't start there because of the increased amount of bleeding and the increased time sometimes that it will take to heal. But the idea is you take that portion of nail bed that instead of burning it, you actually cut it out and you cut it down to the area where there's bone. So some of the previous treatments, the way it's taught over years and years and years is you would make an incision in the skin and open it up so you can do that. You can now actually do a surgical incision underneath without actually injuring that portion of the skin there. You can actually go where the nail is, go underneath the skin, and still cut out that nail matrix in that area. So that's another option. Although it's still not 100% effective, it is more effective than, say, the phenol burning. So if you have an ingrown toenail, if you get to the point where it's bothering you enough that you need to be seen by a doctor and you're saying, okay, this needs to be done, I don't recommend that you have them do a temporary. I usually recommend that you do permanent, numb the toe up, take that piece of the nail out, kill the nail matrix so it doesn't come back. And in most individuals, you will not have to do anything else. So this is Dr. Brandt Gibson, and this is your podiatry tips day 214, permanent treatment of ingrown toenails. Thank you, and have a great rest of your night.